great. It's so nice to meet you. Okay, Dr. Krause, could you share with us what your project is, what AIM has funded, and what your goals and expectations are for this grant?
Absolutely, thank you. Yes, and thank you again for the opportunity and the funding. It's amazing. So the project I've proposed is to try and find different avenues to strengthen the way we measure functioning in children and young people with mental health difficulties. Traditionally, functioning has not been what the field has been most focused on. The field has done a lot of work trying to improve the way we measure symptoms. And from research I did in my PhD, I learned through systematic review that the great majority of trials published over the past decade covered symptoms in terms of outcomes reporting, 95% did, but only about half covered changes in functioning. But we know that functioning is important to young people themselves, so social changes in social functioning, academic functioning, peer and family functioning. We also know it's important to their families, and even to the clinicians treating them, it's an important indicator of success. I was also involved from 2018 to 2020 with the International Consortium for Health Outcomes Measurement, ICHOM, in the development of a core outcome set for children and young people with anxiety and depression. So the core outcome set makes a consensus-based minimum recommendation of what outcomes should be measured for everybody in that population presenting to clinical care. And I was
much needed. Yeah, that is based. Yes, yeah.
And I was a research fellow in that project, so doing the background research, and the three core outcomes that that working group agreed on were symptoms of depression and anxiety, suicidality, and again, functioning. And already back then, the working group struggled to identify anything close to a gold standard measure of functioning, in part because it's so important, increasingly important, to consider young people's self-report when we measure outcomes in mental health, to give them a voice. And actually, historically, functioning has been measured more from the parents and from the clinician's perspective than from the young person's. So we're limited in terms of the measurement instruments we have there. And there are also psychometric limitations to the measures we have at hand. A lot of things we don't know, for example, how well does the content of those measures reflect what functioning actually means to young people? It's also not a terribly well-defined construct. So all of that together creates a situation where we have a domain that's really important to measure. More or less now everybody agrees it would be important to measure, but we don't really know how to go about it in a way that's meaningful, valid, and also youth-centered. And so what I've been working on over the past year is scoping umbrella review, so a big review that tries to identify all the functioning measures that have been used in child mental health contexts, but also quality of life measures and well-being measures, because there's a bit of conceptual overlap. So really mapping that landscape. And in the project that I've proposed for AIM, we're going to build on that review work by doing essentially two to three things. The first focus is on the content validity of functioning measures. Content validity is how comprehensible are they? Do youth understand what the items are trying to get at? Is the measure comprehensive? Does it cover the concept adequately and fully? And then is the measure and its content relevant to what young people experience? And it's not a very well assessed psychometric property. And we don't really have tools to assess this either. So the first strand, or the first pillar of the project I've proposed, is to work with young people. Here at CAMH, we have a very strong youth engagement initiative, to work with them together to develop a content validity checklist. And there'll be two phases to that. The first is qualitative, and will be focus groups with children and youth with experience of common mental health challenges, anxiety, depression, and self-harm, and just to have open-ended discussions of what it means for them to function in their daily lives, and how do they know that functioning gets better? What does that look like? And then informed through those discussions, we will develop, again, through co-design with youth, a content validity checklist tool. And then in the next step, work with youth to apply that to some of the most commonly used measures of functioning that we've identified through the review that I've been working on so far.
Mm-hmm.
So yeah, that's strand A. Strand B looks at the interpretability of outcome data that we collect with functioning measures. So with psychometric scales, it's always tricky to understand what does it even mean, a change. You improve by 5 points on that scale. What does that mean? And there's an indicator that's called minimally important change, which it's a way of identifying the amount of change on such a scale that translates into a magnitude of change that young people or families find relevant and important. And so, yeah, to make it short, the second strand looks at identifying that minimally important change indicator for two selected functioning measures.
Mm-hmm. Wow. Yeah. So I think you've already really touched on this, but one of the things that's really important to AIM and just this movement to improve the mental health and well-being of children and teens and young adults, our mission is really the replicability and not the replicability, but also what does this research give to the field? What does it add to the knowledge base? You really did describe it earlier, but could you talk a little bit more about how the completion of this project will add to the knowledge that we currently have?
Yes, I think this project will contribute to, or hopefully help improve current practice and enhance the knowledge base in a few ways. First, by allowing us to measure outcomes in more diverse ways. So not just focusing on symptoms, but also considering how symptoms affect daily life and how that changes over the course of treatment, because we know that the two dimensions don't necessarily change together. One might change, but not the other, and vice versa. So if we only consider symptomatic change, we get a one-sided view of whether treatments are impactful or not. And functioning is very important because it's a big aspect of what brings people into services, right? And what drives help seeking.
Oh, yeah. Yes.
So having a tool that we have confidence in terms of it being relevant and valid in assessing that construct of functioning will be very important, I think, to have more trustworthy findings in that area. Another aspect is the ease of reporting. So this is where the minimally important change indicator comes in. If we want to consider functioning in evidence-based care, then we need data on functioning that different stakeholders can understand and work with. That's policymakers, clinicians, young people. That data must be interpretable for them, but we know that a lot of statistical indicators aren't really understood well, not even by clinicians, and even harder for young people and families. So having an indicator that can be easily interpreted opens up opportunities for example, shared decision-making in clinical practice, and just having data that's more accessible to all stakeholders who should be able to access it.
Yeah, one of the appeals of your proposal really was that this, the potential for this to be brought to therapists as a useful tool to really use and assess and measure. It's so needed. It'd be so helpful. And there's the vastness of the application possibility of this and to implement it. So there would be a training component and pieces of that would come after this study, right? Yeah.
Yes, that's true. Absolutely.
Yeah.
And I don't know if you've followed the kind of common metrics agenda of major mental health funders like the Wellcome Trust and NIMH. They issued a recommendation recently for 3 measures to be used in adult depression and anxiety research that they fund. And the WHODAS 2.0 was the functioning measure for adults.
Okay.
And for children and youth, they could not recommend a functioning measure because they didn't find one.
Oh,
that was
here we
good
are.
enough. So here we are, and there is
that is yes.
clearly a gap that we need to address
We need to
sooner
address
rather
that.
than later. Yes.
Yeah, you know, really the mission of AIM is to bridge the gaps. We're looking at when we see a gap, well, we can bridge it. And this is a tremendous, tremendous, you know, contribution to bridging that gap and bringing better care to kids. So thank you so much. And we look forward to having an ongoing relationship with you and to following your work and to really helping you with a successful project. Yeah.
Amazing. Thank you so much. I'm really grateful for the support.